The Big Story on 105.9 The Region.
With COVID numbers skyrocketing and we're in the depths of the sixth wave, it is hell on healthcare workers in the region and the GTA around the province. To talk more about it, thrilled to be speaking to an emergency doctor in New York Region on the front lines every day, Dr. Stephen Flindall. Stephen, how are you, doctor?
I'm okay, thanks, Jim.
Well, I mean, I don't. My sister's a nurse in Nova Scotia, and she tries to tell me what it's like. And you used the term the other day, I feel utterly defeated. Doctor, try to explain to the listeners why this feeling for someone with your kind of experience in healthcare.
Well, it just feels like we've been really working our butts off for 2 years, and we're facing another wave, and any kind of measures to protect the public and therefore the healthcare system have just been dropped. And nobody's interested in doing anything to help us out anymore.
I see your comments on social media and other healthcare professionals in the province. It feels like you're talking in the wind. Like, is nobody listening to your warnings, your feelings, and what you're dealing with every day?
It doesn't seem like it. I mean, the government just keeps talking about how many beds they've built to care for the sickest people in the province without kind of taking into account that less sick people are still going to get sick, still have problems, and still come to the emergency departments, put a strain on the acute care system.
ICUs are a big problem, doctor. Everyone's talking about how packed they are. In your respective hospital, how packed is your ICU on a daily basis?
Well, the ICU I don't think is too full at the moment, but during the I can't recall if it's the fourth or fifth wave now. We had one of the most utilized ICUs in the province. We were shipping patients to other ones, and then they actually delayed the opening of an acute care hospital just to offload COVID patients.
I know you were quoted in an article that do the right thing, stop being afraid of the vaccines, get them done, and protect everyone. And my wife and I were talking about this, Dr. Flindall. And growing up, we didn't even think about it. Our mom had the yellow packet with our vaccines. We didn't ask who made it, where it was from. We just got the vaccine and went to school. Why is it such a big deal now? Why the resistance to protect you and your family with a vaccine?
I don't know. It started some years ago with this false report by an English physician linking vaccines to autism. It's been totally debunked. The guy was actually stripped of his medical license and the article retracted, but then you get celebrities glom onto it trying to increase their profile. And that kind of just gained momentum. And then when you had the introduction of these newer RNA vaccines that actually had been, a decade in the making, people just kind of linked conspiracy theories together, and here we are. And plus, it was politicized very strongly in the United States, and we've seen the spillover that kind of sentiment into Canada.
Just for some background, how many years have you been a doctor?
I've been a doctor 25 years now.
Sorry,
22.
So well over 2 decades, and we see, New Amsterdam and Chicago Med and all the stories of what it's like. What is it like for you on a daily basis when you go to work?
Well, it's certainly not as dramatic as those shows would make it out to be, but it's just a grind. I mean, you go in, like yesterday I saw another half dozen kids under 5 years old. One of them was on the verge of needing admission, and then you got other people coming in who are older, should by all rights be vaccinated, actually with extra doses because of their medical conditions. They've refused the vaccines, and now they're in with serious problems with COVID, and they're asking you to kind of pull them out of the fire. It's just very, very frustrating.
When does it get better?
God knows. I mean, hopefully after the next little things will get better if people kind of realize what's happening to us over the last 4 years.
I mean, I know for a lot of people, they feel that spring, summer, good weather outside, it reduces the risk. Does it?
Mm-hmm. Oh, yeah. There does seem to be some seasonality to this. And, but even Dr. Moore, who has been really downplaying this recent surge, is saying he doesn't expect the wave will peak until into May now. So that's like another month of, bad things happening to the Ontario population and stress on the emergency departments.
How short-staffed are you on a regular basis at your hospital?
Last night, I know we were short 5 nurses, and we've been having sick calls from physicians on almost a daily basis now.
Dr. Stephen Flindall, thank you so much for doing this. Thank you for what you and the men and women you work with every day do for us in the region and the province every day. It's deeply appreciated, and fingers crossed we do have better days and you do have more normal shifts that's more like what we see in TV and not what you're going through right now.
Oh, okay. Thanks, Jim.